What I would like to point out today are the chronic neglected ruptures due to long-lasting cortisol medication or antibiotics. So before I continue to get into the details of the FHL transfer, I would like to step back a little and talk about the principles of hindfoot endoscopy. I've tried to do that arthroscopically as well by weaving the tendon through the proximal stump, but the problem is there's so many degenerative tissue in the proximal stump. It's very difficult to pass the tendon through this bulky degenerative tissue, so I stopped doing that. It's very time consuming, and maybe then you're right, it's easier to perform it open. As I already said, it's a salvage procedure. I would not sacrifice the tendon if I don't have to. And compared to the situation before the operation, most patients are very happy because they didn't have any strength for plantar flexion before. And then they get back their strength for the ankle joint. They don't notice the reduction of the push-off so much. There are some studies saying that the best lever arm is at the highest point of the tuberocalcaneae, so the highest spot in the central, so in the medial lateral diameter, the central part of the calcaneus. More to the dorsal aspect, but when drilling, one has to be careful because you need to leave enough bone stock in the posterior part of the tuber, otherwise you will get a breakout of the screw. That is a problem because there is no right tension. You can't measure it. It's difficult. What I do is that I pull the tendon into the tunnel and then I fix it with a clamp at the plantar skin. So it's like basically fixed. And then I compare the dorsiflexion to the other side. So when dorsiflexion is identical to the other side, it's for me a good parameter that tension is good like this. So the message I would like to bring home to you today is that, to my opinion, the FHL transfer is a very good salvage option in risk patients with long segmental defects of the Achilles tendon. One advantage is that this procedure can be performed regardless of the composition of the Achilles tendon. And the second huge advantage is that the soft tissue envelope is preserved, thus preventing wound failure.